I think, first of all, it's important to note that there is an extensive body of work that demonstrates solutions that improve health equity. Everything from collecting and using data to guide interventions, to paying for equitable outcomes rather than just hoping that they come into play, to community-based resources and extending services outside of the medical center. I think so many of those are founded on some three similar premises that I talk about more in the book. And those are: moral leadership is imperative. There is nothing but influences. There are myriad influences that are telling you that your balance sheet is the most important component of your healthcare system. That is not true in healthcare. That cannot be true in healthcare. There must be a moral imperative that what you are doing is something that is bigger than a profit loss. The other thing is creating systems. Anything that is dependent on re-educating, whether it's an employee or a patient population, will fail. That we must, or that's requiring that either a villain is removed or a hero put in place, that will also fail. We need system solutions because it's systems that are creating inequity. And that at all points in every decision, there must be humanity at the center. So much of what happens in this crucible that I described early in my career, where a wall was being built, was there wasn't any race in that conversation. There was no, well, we want to harm this population. But once you center humanity and ask, if we do this, what will its impact be on people? You can get yourself out of that trap on your own. And so centering humanity in all of your work is the third thing. But I also want to reiterate that, as I said earlier, until we create a just society, we're not going to get there, because these are not economic or even leadership questions. These are moral questions. This is about, what do we owe one another? And do we see one another as fully human? Will we allow our racial caste system to dictate our outcomes, or are we willing to dismantle that? Until we make those big questions and bring those into our conversations, we'll be stopping the bleeding, which is important, but that won't solve this.